Pneumonia in the children of Vientiane. What is pneumonia? This common lung infection can be in one or both lungs and is usually caused by bacteria and viruses. Pneumonia causes inflammation in the air sacs in your lungs, which are called the alveoli. The alveoli fill with fluid or pus, and it is harder for oxygen to reach the bloodstream, making it difficult for someone to breathe. Pneumonia can spread easily through cough, sneeze, touch, breathing, sharing drinking glasses and eating utensils, or touching used tissues. Since children in rural areas of Vientiane don't usually have vaccinations, they are more at risk of developing pneumonia. Statistics. Pneumonia takes the life of a child every 20 seconds and accounts for 16% of child deaths below the age of 5. 99% of pneumonia-related deaths happen in low-income and middle-income countries. Since pneumonia is the most common among school children, this kit focuses on pneumonia in children 4 to 8 years old. According to World Health Organization, 23 children die every day in Laos. The 3-delay theory of WHO is that 1. Mothers don't know the symptoms, 2. They have no access to health facilities, and 3. Healthcare providers don't provide proper care. This video will address the symptoms, and the kit may decrease the need to go to health facilities, or at least allow families to have more time. Only 40% of mothers take their children to the hospital in Vientiane, and only 40% of those who arrive at the hospital get antibiotics. The basic symptoms of this infection are coughing, fever, fast breath, stuffy nose, shaking chills, vomiting, chest pain, and abdominal pain. Children need more attention because their symptoms are more subtle. You can tell the difference between the stages of pneumonia with the symptoms. Mild pneumonia has dry cough, low-grade fever, mild headache, sore throat, tiredness, skin rash, cough, and ear infections. Moderate pneumonia has sore throat, cough, low-grade fever, nasal congestion, diarrhea, loss of appetite leading to dehydration, and lack of energy. Severe pneumonia, being an extreme case, consists of high fever, sweating or chills, flushed skin, bluish tint to lips or nail beds, wheezing, and difficulty breathing. Pneumonia caused by bacteria causes rapid development of the infection, and this leads to sudden high fever and unusually fast breathing. Pneumonia caused by viruses have more discrete and less severe symptoms, but wheezing is common. The difference between a bacteria and a virus is that a virus is smaller and requires a living host, while the bacteria doesn't. Effects. The main effect pneumonia has on the body is weak immune system because the body can't filter out germs from the air. Treatment. Pneumonia responds very well to antibiotic treatment. It works especially well for pneumonia caused by bacteria. If antibiotics are being given, you should make sure they are being given by schedule. More basic treatment is to get plenty of rest and drink lots of fluids. For wheezing and trouble breathing, an inhaler gets rid of that for short periods of time. To keep track of the infection, temperature should be taken every morning and every evening. If the temperature reaches above 38.9 degrees Celsius, professional medical attention is needed. The kit. Welcome to the Children's First Aid Kit for Pneumonia. This kit contains various objects that will help prevent this infection. There are 2 boxes of erythromycin antibiotics for children. Although my age group is 4 to 8, this medication can be given from 1 to 8 years old. It comes in little sachets, and there are 24 sachets in each box with 250 milligrams in each. Sachets are very easy to use and are a lot less intimidating than pills. This medicine is used to treat and prevent bacterial infections like pneumonia. For children 4 to 8 years old, 1 sachet should be taken 3 times daily. The best way to keep track is to have 1 glass with 1 sachet each, preferably before every meal, breakfast, lunch, and dinner. This medicine works best when given with only half a glass of water. To use this medication, dissolve the contents of a sachet in half a glass of water. Shake until dissolved. Let stand and shake again before swallowing. Once the symptoms are gone, it doesn't mean the infection is as well, so do not stop taking the treatment. It is best to continue for another 2 days. Any feelings of fatigue are not from the antibiotic, but from the infection itself. The ORS helps with dehydration, which is a common symptom of pneumonia, especially when experiencing diarrhea or any other symptom that may cause rapid loss of water to the body. There is 1 big box of ORS in this kit, which contains 100 sachets. Each sachet has about 3 grams of powder. ORS does not have a specific volume to drink like the antibiotics. Whenever one is thirsty, they should add 1 sachet of the powder to their regular glass of water. Kids over the age of 5 can drink as desired, but for age 4, 4 to 10 glasses are recommended. Since the main cause of most pneumonia cases in children in Vientiane is bacteria and sanitation, the soap will help all family members not only keep themselves clean, but also keep their kitchen utensils clean. Although there are only 2 bars of soap in the kit, the hope is for people to understand the importance of sanitation and continue to buy soap regularly. Pneumonia is almost always accompanied by trouble breathing and wheezing since it is an infection in the lungs. A great and easy way to temporarily get rid of this feeling is to use an inhaler. In addition to the inhaler, the kit also contains a child comfort mask with a valved holding chamber to make the whole process easier and more comfortable. Right before use, make sure to shake the inhaler well. Take off the blue lid cover on the tip of the case and push the inhaler into the appropriate end of the mask. Cover the child's face so the nose and mouth fit perfectly in place, and press down so there are no gaps around the mouth for air to escape. Press down in the inhaler itself to release a gush of air. As soon as you press, the child should take a big inhale and big exhale. Repeat the inhaling and exhaling process 2 more times. If needed, 1 more press of the inhaler is fine, but not more than that. The whole inhaler has a total of 200 actuations. Lastly, the thermometer comes from the American Red Cross. It is a model meant for children and comes with a protective case. This thermometer can be placed in 3 places: neck, armpit, and anus. For infants, the anal thermometer is recommended. However, the best place for children ages 4 to 8 is the armpit. To turn the thermometer on, press the gray button below the red cross and above the screen. Once the screen turns on, you will hear a sharp beep sound. Then you should place the metal and gray tip in the child's armpit, but in a way where you can still see the screen, like this. Count to 30. During this time, the child should be still and taking continuous deep breaths. Once you've counted to 30, take the thermometer out and record the temperature that it says then. Only record the temperature given on the thermometer once it is out of the child's armpit. When done, remember to cover the thermometer with the protective case again once cleaned. Thank you for learning about my kit to help children in Vientiane cure and prevent pneumonia.